note to show you how to do a medical exam.
Perfect. So we're going to go to our patient. We're going to assign them to ourselves. And here I can see a bit of information about their appointment. So I can see that Catwoman is here for a rash, and there is an appointment done by the person that helps set up the appointment. So I can see that the patient will need liquid nitrogen on a wart as well. I'm gonna go ahead and go to patient, progress note, and then we will go ahead and ask the patient to confirm that they are here for a rash and that they have the wart that needs to be frozen off. Let's say the patient has a rash all over their abdomen and they have a wart on their right hand. We're gonna go ahead and write their chief complaint here. So we'll put patient has rash on abdo. The patient also said that it was very itchy and has not used anything to treat it. Very itchy, has not used any medications. Period. Patient also has a wart on her right palm. Okay, and we also want to make sure we're logging in their patient's temperature, which we'll do patient's temp. And let's say the COVID consent's at 98.2. We can press done. We have that ready. Now we want to make sure we add it to your mannequin. So we would go right over here. Now we know the abdomen, the rashes on the abdomen, and doctor will also be taking a look at the wart on the hand. So I'm gonna go ahead and create a treatment plan. So we already have the complaint, which is the rash. We just want to add the treatment plan. So we'll go ahead and go to the red, and we would do dermatitis, contact derm, and it's on the abdomen as the patient stated, so we're going to go ahead and click on there.
You do not need to know the diagnoses. So when the doctors are speaking to the patient, they'll say this is like contact dermatitis, and then you can apply contact dermatitis to that rash. If they said this is pityriasis rosacea, you can look up that particular template. And that's why you're paying attention to decipher what is being said to the patient so that you can document it.
In some cases, as they have a rash, most likely they're having dry skin, itchiness, so there's additional diagnoses that you can add as you start to learn them. So for contact derm, we usually always attach cirrhosis right here,
Which means dry skin.
and we know it's on the abdomen because if they have a rash, they have dry skin on the abdomen as well. Now it is important that we do their exam, which would be right here. You're going to click on this arrow and you're going to put normal exam. Here we have different areas where Dr. Kormeili would be examining. So now we know that the doctor would have to take a look at the abdomen and the hand. As the doctor is doing the check for the rash, she will also be looking if anything stands out to her as well. So most likely this is going to be a waist up skin check. I'm going to go ahead and click on that. And you also want to make sure, we usually do this as the patient is new, but we always want to make sure we double check that we have their Fitzpatrick done. In this case, we don't have the Fitzpatrick. Let's say that our patient Catwoman is a level 3, and we're going to go ahead and press done. Now, the patient also reported a wart on the right palm, so you're going to go ahead and add that in. So we're creating a new.
And let's assume that we're going to treat that with liquid nitrogen.
So we're going to go ahead and go to assessment and plan. We're going to go ahead and type in VV, which is verruca vulgaris, and we can see if anything shows up. Nothing yet. Again, Dr. Kormeili said we're going to treat it with liquid nitrogen. So what we can also do is type in LN2, and we can see here that the LN2 for the wart, which is the verruca vulgaris, will show up. So now we can go ahead and click on that. And you always want to make sure you're being accurate from your right and your left. So again, the patient said it's on their right palm. We're going to go ahead and zoom in. And let's say it's right here. Okay. Now you want to go ahead and right. And now you can see that you have your liquid nitrogen for the wart. Let's say Dr. Kormeili recommended to freeze the wart, but the patient is denying the treatment. You would do the exact same thing, but now we're going to go ahead and put that the patient denied. You're going to go ahead and click on the location, go to your scalpel. You would go ahead and click on the procedure, and here we can see the status. Status shows performed. We need to change it because the patient denied. So here we can see that there are different forms of the progress. In this case, the patient refused, and we can go ahead and adjust it. Once we close it, we hit close, we're going to see that it doesn't show us an active treatment anymore.